Cool. So Kelsey, we are here at Wonderland in Miami. It's almost been a year since you and I first connected,
Yes.
and a lot has happened, a lot has changed since then. I know it's been a bit overwhelming here so far, but tell me what the experience has been like for you so far here in Miami.
Miami's been amazing. I think two things I'm loving the most so far. We're what, 2/3 of the first day in, so
Yes.
temper your enthusiasm. I would say meeting real people,
Right.
looking in the eye and feeling the connection of people who we spent all this Zoom time with.
Right.
And then the second thing is, I don't think I really realized how early we actually are in this industry. I think, I'm in my little echo chamber, all my Zoom calls with my, but then coming here and realizing, yeah, those are pretty much the people who are building the industry are all here. Mm-hmm. And that's a astounding kind of notion, because a lot has happened in a year. And then you think about, these are all the people that will make all of that and more happen in the next year. And that so many of these relationships we've been developing are really solidifying over these couple of days. I think this is one of those moments a lot of people will be like, do you remember the first Wonderland event? I had a conversation at that changed everything. I think this has that potential, which I like that vibe.
It's exciting, and it's
super
exciting to be here and a part of it, right?
I love it.
Yeah.
I love it.
Yeah.
Yeah, I mean, we're really happy to have you here, and it's exciting to be able to kind of talk a little bit more about what's been going on with MindCure. I know that David had a couple of questions about kind of entrepreneurship and having that role as a very kind of strong woman figure in this space. We really respect that, and we really appreciate that you're able to kind of bring that energy for this movement so far.
Thank you. If I was standing, I would curtsy. I was taught that at little girls' finishing school, you see. So I have both sides of a thing.
Right.
Yeah, I mean, I think there's, again, a couple of pieces around that. One is there are more women coming into the space, which is amazing. But I think just generally speaking, this idea of people have been really welcoming. I've worked across a lot of different industries, and when I started MindCure, people are like, whoa, drugs, like women and leading, that's going to be tough. It's old boys club. And I was like, I've done that in construction. It shouldn't be that hard. And I found the psychedelic ecosystem to not resemble that same kind of old boys sentiment, even though most of the companies are run by fellas, but the engagement has been totally different. I think it's part of being in this industry, is this idea of working together collaboratively. And really, who do you want to do deals with? People you trust and understand. And it doesn't really matter if they're wearing a brassiere or not. If you trust and understand them, you can do business. That's kind of how I've just always approached it.
Right. And I mean, business. I mean, you were not once but twice named Female Entrepreneur in Canada. Congratulations.
Thank you.
How are you bringing that business experience and expertise here to the psychedelic space?
I think it doesn't matter what you're doing. If you build a team that is strong, well-connected, and has a vision and a real passion for it, you can basically do anything. So for me, bringing over team building and executing and delivering on promises, I don't care what business you're in. If it's psychedelics or it's just being a good person in the planet, you get further faster. Business moves at the speed of trust. That's a fact. You build that, you're probably a little bit further ahead. You build that in your team, probably a little bit further ahead. You're bold and you might take a few risks that people think, geez, what is that woman doing? But you have a vision and you have the belief of your team, same thing. So I think to me, it's just kind of business building 101.
Yeah.
But it's hard because it is an early industry and there are no maps. And there is no necessarily way it's done, even with the drug development. There are phases, but incorporating therapy in with drug development, it's nuanced. And so I think part of it, it's a great question. I'm thinking too about this idea that people who have had the opportunity to really forge something different before probably have a little bit of a leg up in that for a moment you have to stand out there naked. Right. You have to stand out there and go, here's my idea. Right. And this is all of it. Particularly when you're publicly traded. There's no, you have to really tell investors what your vision is and hope that they place their bets on you. So I think that's what I bring. I don't
Yeah,
know.
no, I think absolutely.
Pretty brass tacks.
Yeah,
I don't beat
yeah.
around the bush too much.
Yeah,
You know?
and I appreciate that. I mean, and I hate to use it, it's such a cliche, but I do feel like we are pioneers.
Yeah.
I almost liken it to like we're on the Oregon Trail, and we don't know what's ahead, and we're all trying to survive. We're all
Yeah.
trying to figure stuff out, in the terrain ahead of us. I find it exciting. I know when we first spoke last year, one of the things that really struck me was, you said you wake up every day with a feeling of enthusiam and inspiration to be a part of this space.
Totally.
Has that changed at all? I mean, are you more
Okay,
inspired now?
every day I'm going to say,
Maybe not every day, right?
some days I wake up and I'm like, oh my, I'm tired.
Right.
It's,
It's a lot.
It's a lot. And we
Yeah.
have been grinding hard. However, I will say at least once a day, I do think, man, if you'd said to me, hey, Kelsey, your biggest problem is going to be solving something, leading a company in psychedelics, and spearheading something that's never been done before, I'd be like, I'll take that problem however big it is.
Yeah.
So sometimes it's just about being reminded of the great opportunity we're afforded to be this early. And like, what is it? Is it Spider-Man? With great power comes great responsibility or whatever.
Yeah.
I think there's also that piece of it, which is all of us have an opportunity to really shepherd in something revolutionary, and being thoughtful about how we choose to do that, what we choose to promise, being mindful about what we can deliver.
Right.
Will bode well for all of us. There's exciting results coming. There's exciting research.
Yeah.
Yeah, I'd say at least once every day. But waking up first thing off, I will say the odd day I'm just like, oh girl,
Yeah.
get a coffee. Here we go.
So I know you just got off a panel, just finished
I
speaking,
did.
and I think it's probably the most interesting titled panel, here, and topic-wise.
Thank you.
Sex and psychedelics.
Yes.
And I know that kind of ties into some of what's going on with MindCure, with the
Yes.
Desire Project. So you want to talk a little bit about that?
Sure. I'll tell you that room was standing room only, and they were out in the hall, which I was like, oh my gosh. This is
Hanging by the rafters.
It
huh?
was amazing.
Yeah.
I think there's a couple things that implies to me, which is so exciting. One, we get to talk about this openly.
Yeah.
So it's okay for me to say I'm a sexual human being with desires, and it's important to my mental health that I get to talk about that and it's recognized. It's like an integral part of being adults. That's a revolution.
Right.
Just that alone, which seems kind of laughable in some ways, and then you pair that with psychedelics. I'm sitting in that room and I was like, this is absolute, even 3 years ago, I could have pitched this to someone and they'd be like, oh, and how involved the audience was. Like questions coming up afterwards, all of this, and really thoughtful explorations into what it means to be connected.
Right.
And what does it mean to, when we're talking about the Desire Project and art research, I always like to be clear that there's orgasm in the fireworks show, and that, everybody likes that. There's all of this before that, which is arousal. Mm-hmm. It's physical, it's in our bodies, and partially in our minds. But before that, there's desire.
Right.
And that's right here. That's where it starts. And this idea, somebody had a question, they said, or a comment, and they said, I had forgotten about how much joy I get from just exploring desire for myself, and how much of an important part of that, thinking about my partner, thinking about the future, thinking about a past experience, and how that can, enliven me. I think we have the opportunity in this industry to explore some new frontiers in a variety of ways.
Right.
And to deepen these conversations and not have them at this really surface like,
Yep.
It's a great tagline, orgasms for all. Who can disagree? But what we're really after is deeper connection to self and other, wholeness, clarity, and this deeply intimate experience. Mm-hmm. And when you talk in that language, everyone agrees and everyone is quite open to speaking about it. But that's a tougher, more personal conversation. But that room today, they were just like, we're in, this is great.
I think this is the right place to be able to introduce those kinds of topics, because generally psychedelic users are open to new experiences. How would you say psychedelics themselves actually influence, that desire or, the sexual experiences?
I mean, what we do know is that desire is rooted in the mind, and we do know that a lot of the people who have a challenge with desire have some kind of history of negative experience with respect to sexuality or sex. They may have negative body image issues, so they're not able to like be fully present. They're not living in their body. So even if someone touches them, it's, you know, it doesn't really go too many places. So how do I think the psychedelics relate is really like the overlay of allowing a person to downgrade that fear network to get to the place of like, this could be safe. I might be able to embody this. And an interesting part about this conversation today, which got a lot of hands up too, was this talking about masturbation and talking about connection to self and how that's like got a whole world of shame often around it. It was bizarre, but true, or can have. And this piece around psychedelics uniformly, I think, helps anyone who's doing the work to clarify for themselves how they connect to self, even not physically or sexually, but just who am I in my, you know, in my essential place, which is the beginning of the healing, which is to kind of reclaim our own boundaries and our own explorations. So I think it's, to me, such an of course moment to go, well, of course.
Yeah.
Like, as an individual, reclaiming how I choose to show up in my relationship to self and my partners and sexuality is a part of all of this human experience that, you know, quite candidly, a lot of us grew up and we were told this is how you do that. You do this, you don't do that. No, you know, don't dress this way, don't say that. Don't ask a boy out, that's too, you know. Yeah. Like these very micro little cuts at how we engage in our relationship. There's a lot of layers to unpack, but thankfully psychedelics allow you to kind of strip all of that kind of, you know, all of these filters, that facade of it.
It really does, and I think that's what's so exciting and so encouraging. You know, I think for some reason, you know, we as a society like to try to sweep, you know, sex and sexual desires under the rug and pretend that they don't exist, but they're there.
It's crazy.
Yeah, it's crazy, and you know, it's like no, they're there. We all, you know, whether or not we want to talk about it openly, you know, it's something we all experience, and so I love the fact that, you know, you're bringing this conversation to the forefront, and I think that is what psychedelics, like you mentioned, is all about, and it really is about, you know, removing that facade. So it's great that I love that. I love that you're bringing that again to the forefront, and I'm glad that it got a great reception out there.
It's a lot of fun. I mean, the other thing I will say that's interesting about it is this word sex. So we got the people in the room with sex and psychedelics. We kept the people in the room with intimacy and connection. And I don't care what indication we're looking at, actually, that's at the root of many of these things. Right. You know, when we're talking about PTSD, when we're talking about depression, when we're talking about anxiety, a lot of it is kind of like in this echo phase of like, what is really hurting with respect to humanity? Not to get a little too global about it, but what are all the things we already know we need to be talking about? Right. That this is just an opportunity, a vehicle for us to say, you know what, okay, it's time. We can do this now. And thankfully, there's some great CEOs in the space and some great leaders in the space and philanthropists in the space and patients in the space who are willing to come forward and say, that's what's happening for me. This is how I addressed it and it worked for me. Because that's super brave and bold too, you know?
Right.
I think it's also a matter of being able to bring that conversation to the table to start that conversation for, you know, a widespread audience, because we're all thinking it to some degree. We all have these conversations in some form, maybe in our intimate settings and with our friends, but you know, we just need somebody who has started that movement so that we can make that okay and normalize that for ourselves.
There's, I think, 3 pivotal conversations I'll share with you that I had. So one is a group of girlfriends. We get together every year, a bunch of business owners, and we drink wine on the beach and we come up with business ideas. And I was speaking with these gals and we were talking about the Desire Project, and the one woman said, well, that's half of what I talk about at my book club. And the next woman said, oh, yeah, that's all I talk about with my sister. Oh, yeah, I didn't know that was a thing. My friend, and it became this whole, I was like, okay, it's here. It's a thing. Right. And then the second one was with a finance fellow. And he said, oh, I've never experienced that, ha, 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 with this idea that like no one wants to admit that their partner might have been faking it or whatever the case may be. But then a little bit further down the text thread was this very sincere comment of, now I kind of feel like I want to make sure that everyone is equally as engaged in these intimate acts. And I never really considered this notion of maybe some people, it's not, when they say it's not you, it's me, they really mean it. Like they're really just having a hard time with being that present with a person. And then, and then the third one was another finance guy who, took a look at the market, was like, why hasn't anyone done this before? But I said, to that point, I think it's just timing, isn't it?
Right.
Yes.
3 years ago, you couldn't have come with this program.
Yeah.
It would have died on the vine.
Yeah.
So it's just a little bit luck, timing, being in the right place at the right time. And, I don't mind talking about intimacy and sex and drugs all day long. So.
Well, I mean, I think it helps inspire the conversation. It gets it going. I think that's what's important. Kelsey, we don't want to take up too much more of your time here.
Okay.
But listen, 2021 has been a wild year. I think what you guys have done with MindCure has been incredible. You made some incredible strides here. For those out there in the investment community, what would you like to share with them in terms of, what is ahead here going into 2022 for MindCure?
Sure. So I would say top line catalysts. We have a digital therapeutic. It's going commercial in Q1, Q2. That's kind of a smasher. We have some recent news on that. Partnership with Awaken, distributing protocols. That's great.
That is.
On the drug dev side, you're going to see some updates on our Ibogaine program. You're going to see some updates on some novel work we've been dark opsing.
Exciting stuff.
And you'll see the Desire project move into actual human trials, like our pre-IND is being scheduled, and so that's going to advance pretty quickly. So, not long before we're solving that problem. Lots of catalysts.
Yeah, exciting, right? Very exciting
Fast
stuff.
times.
Yeah, definitely. Well, I mean, listen, I think every industry needs leaders like you. And again, I just appreciate everything that you're doing here for this space. And I love continuing to follow you. And that passion that you have for this, I love it. It's second to none in my opinion. So
thank you.
Really,
It's
really
definitely
enjoy
infectious.
It
And I think
is.
that, it's you're kind of setting a standard for a lot of this work in a way.
Oh, thank you.
Yeah.
That's lovely. I'm trying my little heart out.
You're doing great at it, so keep it up. Kelsey, we look forward to continuing to stay in touch. It's been great to finally meet you here in person, so thank you so much.
It's fabulous to be here. Thank
Yes.
you both.